Julianne here at Ethos in Sparta. Today we are about to do a radiofrequency microneedling on this beautiful patient. This is Kelly. Kelly, say hi. So Kelly just turned 40 and she wanted to do something special for her birthday. So we are actually doing this in combination with Sculptra, and this is her second session. So we're gonna get started. Are you ready?
Yeah.
Okay, awesome. So this is the Vivace machine, and we actually have radiofrequency microneedling in every location. This machine is great. I'm gonna start with her forehead on some lower settings here. So let's talk about what radiofrequency microneedling is. So it is a, obviously, radiofrequency machine that delivers little microchannels and creates injuries to help promote collagen and elastin production. And what the radiofrequency part does is it uses heat to go to the area and help heal that injury, creating more collagen and elastin. And this is just a great overall procedure for anti-aging. I think it's wonderful for everybody. It is safe for all skin types, by the way. And what it helps do is it helps with fine lines and wrinkles. It helps with brown spots, sagging skin, pore size, and just overall skin quality. I think this is best recommended in a series of 3. So like I said, this is Kelly's second one. And we did Sculptra first. And Sculptra is a biostimulator for those of you who don't know. And when you do it right after, it also helps the Sculptra create more collagen and elastin. So it's a great combination treatment. You can combine it with PRP. And you can combine it with other face serums and masks. And really, your provider can kind of tailor it to what you would like to do. So as you see, her skin's just getting mildly red. And it's pretty tolerable. You come in and numb for about 10 to 15 minutes beforehand. And we set the settings per patient. So that is kind of individualized. So it's best to have a consult first and talk about what you want to address and what you want to improve. And then we'll have you treated. And make sure you guys check our Instagram because we are doing the 5-day giveaway. I believe yesterday was buy 2 RFs and get 1 free. So Santa's feeling generous this year. So send a DM to Ethos if you still wanna get that. You still wanna get that. So a lot of people ask, is this painful? The heat really helps decrease the pain, which is wonderful. I get a lot of questions about, okay, what's the difference between regular microneedling and radiofrequency microneedling? Big difference is obviously the heat in the machine, but we are not scraping the surface of the skin with this machine. So you have a lot less downtime. Now, Kelly is obviously doing this. How many days are we till Christmas? 5? 4? Kelly is 5. So Kelly is doing this 5 days before Christmas, and she's gonna be fine for Christmas. Her skin's probably gonna have a little bit of a glow. It's gonna look a little plumpy. It's gonna be great. And yeah, I keep my settings low on the forehead and around the eyes and the nose where there's less fat. And then as I go to the cheeks where we just see a little bit more areas of plump, I'll increase the settings. Now this Vivace, this machine, this is a great machine. We can customize the settings. It has a red light and a blue light. So I'm gonna pause it and just increase my settings. Now the red light is for collagen and elastin production. The blue light is for acne and it will kill surface bacteria. Also, the blue light is good for rosacea because the blue light will also kill surface bacteria, which is what causes rosacea. Is it comfy still, Kel?
Mm-hmm.
I think Kelly's fallen asleep, so it's a really comfortable procedure. And it's best to pair these 4 to 6 weeks apart for the best result. Every time you create that micro injury and then your skin rushes to repair it, when you do that again right after, it helps the whole process of just creating more collagen. So we do the 3 sessions, and then people always ask about maintenance. Maintenance looks different for everybody. But usually I would say once you do your series of 3, you can go on and do one maybe every 6 months, every 9 months, once a year. Again, it's just great for the skin. It helps it keep it thick, plump. And you can do this summer or winter. If you're going to do it in the summer, you're going to want to stay out of the sun for a couple days while you're healing. And make sure you wear sunscreen. And I would say this whole procedure, you're here booked out for about an hour and a half if you're combining it with PRP or Sculptra. But if you're doing it just alone, about an hour. The whole thing, start to finish, takes a good hour between the numbing. And then we go through the whole face. We like to do 2 passes on the whole face just to make sure we're getting everywhere. And then afterwards, we put a, it's actually Epicurus lipid recovery mask on to help kind of calm down the skin. And most people leave here really just looking like they have a mild sunburn. So Kelly, you had this done already. Any feedback on what the first time was like? When were you able to start wearing makeup again? When did you feel like you could go out in public?
Oh, I could go back the next day.
Okay,
yeah.
Awesome.
It was great.
So as you see, she's just mildly red right now. And again, once we put that Epicurus lipid recovery mask on, it really, really calms down. You notice that your skin's a little bit dry after, but you definitely want to just moisturize it. And come on the other side. Okay. And then, of course, when I'm doing a treatment, I'll ask the client, what are areas of concern, and we can always go over that area a little bit more aggressive. Some, people will say, oh, an acne scar, or if they had a scar from something else. In Kelly's case, I know she's concerned with the brown spots, and she has a little bit of melasma, and hopefully this will kind of lighten that stuff up. I would say the most painful area is usually above the upper lip when we do it, but we have really great numbing cream, and we make sure you're comfortable during the whole thing. I think that pretty much covers everything about radiofrequency microneedling. If anybody has any questions, feel free to comment or send a message, and I'm happy to answer them. One thing is, Kelly does have eyebrows that are microbladed, so that is an area that we cannot go over with the device. It is something that, you can go over with a traditional skin pen, but you would not want to do it with the radiofrequency device, as it can burn the skin because of the pigment. But this device is safe for all Fitzpatrick skin types, which is great. Okay, I'm going to do above your upper lip. is probably the most painful. Okay, I'm gonna do your bottom lip now. Okay, we're gonna get started on our second pass where I'm gonna adjust the settings again. Make sure we kind of treat it everywhere that we want to. Perfect. Kelly, how are you doing?
Good.
Good? Okay. So for our second pass, we lower the settings and it's usually more comfortable and tolerable, but again, the second pass really just helps us get anywhere that we haven't gotten during that first pass. Forehead again can be a little bit spicy, but okay, so we're gonna end the live, guys. If you have any questions or comments, feel free to message us. And thank you, Kelly, for being an awesome sport.
No, thank you guys.